Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to deal with a very simple topic, which is the concept of asepsis. So as we all know that asepsis is a state of being completely free from any pathogenic microorganism. This is the process of removing the pathogenic microorganism or even of protecting against any infections that can be caused because of such organism. So now let us move on to the definition of asepsis. So what do you mean by asepsis? Asepsis is the practice to reduce or eliminate the contaminants such as the bacteria, the fungus, the protozoa, or even the parasites from entering the operative field in the surgery or the medicines in order to prevent infection. So in simple words, we can say that this asepsis is the practice which is followed in order to reduce or even to eliminate the contaminants or the infectious microorganism such as the bacteria, the parasite, the fungi, the protozoa from entering the operative field whenever a surgery is performed or even contaminating the medications in order to prevent infection from occurring. So since this is what asepsis is, now let's move to the definition of aseptic technique. So this aseptic technique is the effort which will be taken by the healthcare providers in order to make the client free from the hospital microorganisms as much as possible. Why? Because here when we talk about the hospital setting, we know that there are different kinds patients which will be coming with different kinds of condition. So here, if we follow this aseptic technique, then we will be able to keep the client free from any microorganisms which is present in the hospital as much as possible. And how can we do this? We can do this by making sure that all the equipments, the articles which the previous patient was using must be sterilized, the unit must be fumigated, as well as when we healthcare providers provide any treatment to the client, we must make sure that we do it with maximum precaution. So this asepsis is of two types. The first one is the medical asepsis and the second is the surgical asepsis. So what is medical asepsis? This refers to all the practices which is used in order to prevent the patient as well as the environment in which he lives in from the transmission of the disease producing agents. So this simply means that this is a procedure which is used in order to prevent the spread of disease as well as the number of microorganisms. Changing of the client's bed linen daily or even when it is soiled as well as hand washing are some of the examples of these medical asepsis. So what are the principles of medical asepsis? So what are the principles of medical asepsis? Here there are various principles. The first one states that washing hands frequently is very important, especially when it is before, during, as well as after you have eaten food, after using the handkerchief, after using the washroom, as well as after and before you provide any treatment to the client, and also after you have removed the gloves. And also after you have removed the gloves is very, very important. The soil items as well as the equipments which is contaminated must not touch the clothing of the healthcare workers or of the patients or of the family members. And also whenever you are carrying them, whenever you are handling these soil items, you must make sure that so that it does not touches you or even your uniform. You should not place any soil linen or even any of the contaminated items near the food because this will increase the contamination of both the surface. You should also advise the client to cover their mouth whenever they are coughing or sneezing, as well as they should not do it directly on others. Because of this manner, many of these infectious organisms can be transmitted from one person to the other, either through the airborne or even through the droplet transmission. So that is why it is very important to instruct them about these. And as a nurse, whenever you are dusting or scrubbing any articles, you should make sure that you move them away from you and not keep them near to you, because this helps to prevent these contaminated articles from touching your uniform, your face, your hair, or even your body. We should also avoid raising dust, whereby whenever we clean any item, we should make sure that we prefer doing the damp dusting, as well as we should not shake the linen when we are changing them. And whenever you are cleaning any equipment, any material, any machine, you should make sure that you start cleaning from the surface which is less contaminated and then move to the surface which is more contaminated. And whenever there are any items which is soiled or which must be disposed of, then you should make sure that you do it in the appropriate container. Any wrap item which is moist from the body discharge or even from the body drainage must be kept in the waterproof containers such as plastic tags before they are being discarded to the refuse holders, so that the handler will not be coming in contact to them. We must pour liquid to avoid spilling in the sink and not to us. And any sterilized item which are suspected of containing pathogens after sterilization, then these must be managed by a clean technique. And also here, being a nurse, it is very important that we must use the practices of personal grooming in order to prevent this transmission of infection from that patient to yourself, or even from yourself to the other patient, whereby we must make sure that we personally groom ourselves well. We must cut our nails. We should also follow the guidelines consciously for isolation in barrier technique, as it has been prescribed by the agency. So these are the various principles of medical asepsis. Now moving on to the second type, which is the surgical asepsis. This refers to all the procedures which is done in order to keep the item as well as the area sterilized and completely free from any microorganism, because by this sterilization it will help to destroy all the microorganism and their spores. And this technique is mainly practiced in the operation theater as well as in those areas where these sterile instruments are kept. This technique which is used in the surgical asepsis is more rigid as compared to those which is used in the medical asepsis. So as we have seen that medical asepsis is a practice which is done in order to prevent the growth as well as the transfer of these microorganisms from one person to the other. In this surgical asepsis, we not only prevent the spread of this or prevent the growth of the microorganism, but here we also make sure that all the areas is completely sterile and free from these microorganisms. So what are the principles of this surgical asepsis? The first one is that we should always face the sterile field. So that particular field which is sterile, we should make sure that we face them, and we should not turn our back or side on a sterile field. We should always keep these sterile equipments above our waist level or above the table level. And here we should also instruct that no one should speak, cough, or even sneeze in front of the sterile field. And if it is necessary to do so, then they must make sure that they turn their head away from the sterile field. And also here we must make sure that we never reach across the sterile field. That is, if we need to take anything which is across the sterile field, we should never try to overreach through this area, but we should make sure that we go on to the other side to take those particular items. We should also make sure that we prevent excessive air current around this sterile area. And this air current can sometimes also be caused when one is moving fast, when one is flapping the clothes and drapes, as well as by closing the door. So here we must make sure that excessive air current or performance of any activities that causes this excessive air current must be prevented around the sterile field. We should also keep the unsterile objects away from the sterile objects as well as from the sterile field. We should also make sure that we handle liquid cautiously when we are near the sterile field, and we should also make sure that we prevent the drapes as well as the cloth which will be covering these sterile instruments from becoming wet. Each sterile supply should also be clearly labeled as to its content, as well as the final date of the sterilization must be clearly mentioned. We should never ever assume that the object is sterile, and we must always check the sterility expiration date. And whenever these sterile objects are not covered, we should make sure that we avoid sweeping as well as dusting near these objects. And before we handle these sterile equipments or these sterile objects, we should make sure that we wash our hands, and we should wear gloves as well as masks. And whenever we open the sterile package, we should do it in such a way that the edges of the wrapper is directly away from us. And when we talk about the transfer forceps, then we should make sure that whenever we handle these, we should hold it pointing downwards. And when we remove any forceps from the container, we should do it without touching the sides as well as the rims of the container. We should keep the prongs of the forceps within the vision whenever we are using them. We must gently tap the prongs together directly over the container in order to remove the excess solution. And we must make sure that this transfer forceps and the container must be sterilized daily. And when we talk about this container, we should make sure that we remove the cover only when it is necessary, as well as we should remove it only for a short duration of time. Lift the cover of the container in such a way that the inside portion is pointing down. Invert the cover only when it is necessary to place down the object. And once any object is taken out from this container, we should make sure that we do not place it back. So these are the various principles of surgical asepsis. So now here we've come to the end of this topic. I hope you have got a clear understanding of what this topic is all about. I'll be meeting you in another session. Until then, have a good day. Thank you.